In the olden day, they'll be like, doctor, I've got a cough cold. The doctor will be like, take this, you'll be fine in 5 days. And most people don't know what it is. Although they get better, I think it's necessary for us to develop as a nation to know what's our problem. Today, I want to talk about patient education. If you've seen on Facebook, there's a mug which says, don't mistake your Google search with my medical knowledge. Today, we live in a society where Google's at our fingertips. There are many medical apps on the App Store, and basically, patients come to us and tell us their diagnosis and tell us what treatment they should get. If you see, for example, in the UK or in Australia or in the US, a patient can actually come to you and say, doctor, I've got a heart problem. The problem is I've got a triple vessel disease. And I've done a coronary angiogram, and this was the findings. They found that my EF on my echo was 50%. I'm taking a Micardis, I'm taking Plavix, I stopped aspirin because I had GI upset. And that's the kind of response they can tell you. Most of you, if you're not a doctor, you'll probably be wondering, what on earth did he just say there? That is exactly what I'm talking about. We come from a population that thinks they know a lot. But in actual fact, a lot of times they just come to the doctor and say, give me a quick fix. In the Malaysian society, when I asked an uncle, what drugs are you taking? Ada ubat cair darah. In English, it means there's a blood thinner or blood liquidator, and we have to sort of fix that in our mind that that is aspirin or that is Plavix. Patients don't know what they have. And when we ask, uncle, how much is your dose? I take the white pill, I take half, and I take it 2 times a day. And we're supposed to know what that half is and what is that white pill. You know, it's tough. So you gotta give us a bit of credit for that. We see so many patients. We can't spend 20 minutes for one patient, because then the rest of the patients who are waiting for an hour or 2 are gonna get upset and start scolding the nurse. Why is the doctor taking so long? I go in there 5 minutes, waited 2 hours. I just want you to realize that a mechanic takes time to fix your car. We take time to see a patient. We are fixing the patient, who's the car, I would say. And we have to go through all the troubleshooting and diagnostics, which we know, which is in our head, when we see a patient. We don't see a patient and go like, all right, you have fever, you have cough, you have this, okay, this is it. It's you have fever, you have cough, you have this. I gotta think of 10,000 things before I can tell you what it is. And then I'm gonna think which is the best drug for you compared to everything else, because every person is different. It's not like a car where a product like an air conditioning product is an air conditioning product. You know, there's no variance to that. If it fits, it fits. I basically want to tell doctors that we have to educate the patient. Somehow doctors are just not good at conveying a message to patients, where else the sensei, the bomo, the pharmacist, they're so much better. And I think we gotta learn from that, because at the end, we want to better the healthcare, we want to better ourselves, and we want to make life easier for both the patient and the doctors. Like, if I've got hypertension and I'm taking 3 drugs, I should know those 3 drugs and what's the dose, like 20 milligrams, 15 milligrams, or whatever it is. So do educate your patients, because I've got patients who have, for example, eczema for the past 10 years, and they didn't even know what eczema is. They only know, I got skin allergy. I take the cream, the white one, the one with this top, and you know, come on guys. Let's make Malaysia better. 4 out! Oh, and by the way, with patient education, I'm just going to tell you, it's going to increase patient compliance and less wastage. And also let the patients feel like they're in control of their disease. Because at the end, if the patient's not interested, nothing's going to get better. Teach them, educate them, spend a little bit more time than usual, and patients will know that, you know, the drugs they're taking isn't worth 1 ringgit or 5 ringgit consultation. The drugs they're taking is worth 400 ringgit, 1,000. Some people even take drugs, for example, cyclosporin or things like that, which is 100 ringgit, sometimes even in a day, and they take it for months. You just times that. Probably their pay can't even afford that drug. And patients will feel much better with the treatment as well. They won't go to homeopathy or alternative medicine. Let's make healthcare better in Malaysia and wherever you are, if it applies to you, for a better tomorrow. All the best.